Hello everybody. Today we're gonna, well, all the topics are fascinating to me, but there have been so many questions about how do I take care of my root canal treatment. I have a root canal treatment, but what do I do next? How do I take care of it? Because believe it or not, sometimes the endodontist will tell you, and I'm very sure all the endodontists in the world will tell you, after this, what do I expect? Well, what you expect, they will tell you maybe you're gonna have a little bit of a pain. I personally, as having my endodontic practice for more than 20 years, I recommend to have ibuprofen 600 3 times a day for the first 3 days, whether you have pain or not, because you're gonna have sometimes a little pain on biting, maybe not. A lot of my patients don't have that type of pain, but I recommend it because internally it's a battle of the cells. Inside, like you can see on the screen, like if I was working here and I was cleaning this tooth, and then I was irrigating, drying, and putting this together, what happened after that? The bodies have to start reaction of the cells, and these cells are gonna be upset and create some liquid that is gonna give you pain. So I recommend to avoid all this, you help the body to heal, take the ibuprofen at least for 2 days. I usually send it for 3 days, but if you want 2 days, it's okay. You can have a light meal if you want and have that, unless you have gastritis, then you can take Tylenol instead. But Tylenol is for discomfort and helps a little bit in lower the activity of some of the molecules in our body. So after that, you need to be sure to ask your endodontist. Please be sure Dr. Yackerman advised in her channel to have, after the root canal, the endodontist, I'm very sure that he does this. What I do in my practice, if you have a big infection and it has to drain, then I leave an antibiotic inside of this. Let's say this is a hole, so I leave antibiotics and I leave something else. Then I put a cotton, and then I put a soft solution, no solution, it's a soft paste that if there's any inflammation, this is what the space that I do a little hole sometimes comes out, or whatever it happened still is covered. However, this is something that you have to keep very in mind. When we finish a root canal, the sealing that you see in this image, in this x-ray, has to be hermetic. We need to have it so well done that after the disinfection, this has to be impacted in a way that nothing can cross. But you know what? Bacteria are 1 micron, and the freeways of our teeth are 3 microns. So if any bacteria goes through the space between this crown and this tooth, through here, and we don't protect our root canal, guess what? Most likely the root canal is gonna fail. Why? Because if it wasn't exaggerated, clean it again and remove this, the bacteria is already inside, and it's not gonna bother you now, because sometimes take 1 year, 2 years, 3 years. But for me, it's personal. My root canal treatments, I wanna see them 10 years, 20 years later, like I am being very lucky to see even 25 years or more. So if you come and have a root canal with me, you will come every year for the rest of your life because there's no charges. I want to know what is happening. That's what I want to advise you. You have to take care of that root canal like a baby, because not only you spend the money, the time, and you did the effort to do it. And in order to succeed, you put after the gutta percha, which is the material we use, the endodontist should, because that's what I do, and I think most of them in America we do, put Teflon tape, and then on top of it, in the space, I will seal with something that is extremely strong, that is almost permanent, but it's not. It's called Duralon, and it's an amazing material that is gonna stay for a month in case you cannot go to the dentist for the root canal. And has to be so well sealed that nothing will get in that month. But don't later than a month. Be sure that if you can get in with your dentist before, it's better. So the dentist will place something here that is a buildup, that it looks like this. After the root canal, you have this image here. And then after this buildup, it's a material that is gonna be so, they're gonna do like a preparation of your crown that is gonna be, you know, very similar to this area. I show you. Look at this tooth, how it's skinnier, because this one, it was a rotation and run. Now it's skinny, and you have, this is a complete tooth, this is a complete tooth. This is prepared for a crown. So before that is prepared for a crown, the dentist is gonna place a material here that is a resin also, very strong, that is gonna protect. I don't like any space here, but this goes straight here. Usually it's done by the dentist, and then the patient put a crown. But this patient called my attention, and you're gonna see after that, she's very grateful because she said it's our 10th anniversary because this is 10 years that you did my root canals. So then, since I always check every year, I, you know, wanted to share. I talked to the patient, and she gave a very nice testimonial that you will see at the end of this episode, because I really, for me, I tell my patients, it becomes personal. So in the situation like you have, this tooth had a root canal. In this tooth, I did a root canal, and I see the patient, this is 2012, but then the patient comes and it's 2022, and I see the patient, and this is last year, so by now it's 11 years, and the patient is grateful and is happy, and comes in is, you know, I am happy the way the root canal is, and I don't know the crown, if it was changed when I was changed, but I don't see any changes here. So the patient is being okay. And with this also the same. These are teeth that have 10 years in the mouth. But it has to do a lot with the patient. The patient is good to clean their teeth, and it's really good to brush and floss, and she comes every year to see me. And once the crown is done, you need to be sure that your crown is gonna be very well seated, that is not high. And if you need an eye guard because you're grinding, ask your dentist. So the root canal will succeed for more years. Even us, whatever job we did, if you take care the way I tell you, by being sure that your dentist in between your endodontist has a very strong, you know, tape. That's, I will say, tip number one that you have to see. When you finish the root canal, then after that here, I put Teflon tape that is antibacterial, and then I seal it with Duralon. If it's not that hard, you immediately see your dentist, so you have it covered, and there's not gonna be any bacterial leakage. And the tip number two is to see your dentist as soon as possible, so they can do this build-up and a provisional crown, so your crown can be placed. But remember, if you have the Duralon placed, ask your dentist. If you have Duralon seal after the endodontist finish, and you go to your dentist as soon as you have a chance, you have a month with my Duralon to go to Europe, but don't wait 3-4 years. I am sure the majority of endodontists do the same that I do, so after that, you help your dentist to be successful, floss, brush, and your root canals is gonna be so many more years of 10. This is the 10th anniversary, but I have 20th anniversary of patients. If you have any questions, don't forget to subscribe to our channel, Dr. Fanny Yakaman, and give us a like in this program if you like it. If you have any questions, also for Instagram and TikTok. Thank you.